It is a synthetic opioid that was, developed to relieve pain, but it was never clinically approved for market.
It's called cyclorophene and was first detected in the city's unregulated drug supply about 6 weeks ago. According to Karen McDonald with Toronto's drug checking service, the designer opioid has now turned up in several more samples collected from the downtown core and the city's West End.
Initially, we found it on September 12th in a sample that was submitted to our program as a Percocet. But then just last week, we found it in 3 other samples, one that was submitted as Oxy, one as a Percocet, and one as hydromorphone. It's incredibly concerning when we detect a new drug, especially because the drugs are becoming more novel and there's just less information about them.
Since 2019, the organization has been teaming up with community agencies and safe consumption sites to offer clients free laboratory drug screening. And as overdoses hit crisis levels, the testing also helped keep tabs on what's flowing on the streets.
We're generating a ton of data on the drug supply. We bring all of that data together and as quickly as possible educate the community about what it is that's circulating and what anticipated risks may be.
But McDonald says the service is now facing challenges as the Ford government defunds harm reduction to instead directly focus on treatment and recovery.
Because of these supervised consumption sites shutting down, are you taking in fewer samples?
Yeah, so our program earlier this year when the sites closed, we observed like a 40% reduction in the number of samples that we were collecting.
What's the danger of that?
It just means less information, right? Like less information about what is circulating and like how to potentially protect people from harm and death.
At this point, it's unknown how powerful cyclorophene is or the effects it could have on individuals, but McDonald warns Toronto's drug supply is increasingly contaminated and unpredictable.
And there are more drugs presenting that like we just don't know what their effects may be. They're not approved for human use. And so the risks are incredibly high.
The drug checking service has now expanded to 4 other cities, including Peterborough and Kingston. And due to support from Health Canada, over the next 2 years, the service could be offered in all of Ontario's 29 public health units. Shauna Hunt, City News.